Hey guys, welcome to the session. How are you all? So today there's a slight inconvenience with our session, and that slight inconvenience was that there was no electricity at my place. There was some weather issues, so I'm trying to take it with my hotspot. So please pardon me if you guys face any connectivity issues, right? So we're still taking your class beside any difficulties because learning must never stop, and that's the logo with which Unacademy works. So let's start the session. Let's start the session without any further delay. So welcome to the CVS Physiology series. I hope you guys can hear me well and you guys can are able to understand everything. If you have any queries, you can stop me and I'll check the chat in between. Okay. So I'm not continuously monitoring the chat today because of the electricity issues. My phone also has very little charge, so I don't want to risk that. Okay, so let's start the class. Cardiovascular Physiology series. Welcome to the YouTube channel. Let's crack NEET PG. That is there for Unacademy. Okay, it's the Unacademy YouTube channel. So in case you guys feel you need to learn anything, so that's the place where you have to be. My name is Chetanya Mittal. I am an MBBS from AIMS New Delhi, right? So I hope you've downloaded the Unacademy Learning app. What you guys can do is you can register with my invite code Chetanya10 and you guys can unlock the free plan. You guys can unlock free plan on Unacademy and access all the free content that is there. So these are some of the top educators who teach live on Unacademy for plus as well as on special classes. Now special classes are basically free of cost and they are provided to you so that you can take maximum advantage of the application. And right now Unacademy is a one-stop solution for your NEET PG preparation needs. We have all kinds of courses for you guys, live classroom experience with batch courses, regular testing, and we also have a doubt clearing feature. Okay, so yesterday we started with two batches, NEET PG, INICT, in fact four batches. We also started a batch for next. We started a batch for FMG, right? We have so that's for the classroom experience, and we have a 34,000 plus MCQ question bank for your regular practice. Okay, besides that, you can have your doubts cleared, you can have flexibility on the application, and so many features. So just download the Unacademy app, right? We have two subscriptions. One is the Unacademy Plus subscription, where you get access to everything that is there on Unacademy. You get access to all the content on Unacademy, all the features of the Unacademy app, right? And the second kind of subscription is the iconic subscription, okay, where you not only get the benefits of Unacademy, but you are also going to get the benefits of Prep Ladder, okay. And right now for the iconic subscription, we have a great offer going on. We have a great offer going on with my referral code Chetanya10. If you guys purchase the subscription, we have a discount offer running, and the cost for 3 years would be 60,000. The cost for 2 years it would be 50,000, and if you take it for 1 year, the cost would be 40,000 rupees. Okay, so that's the subscription going on. And for Plus, these are the details. For 1 year, it's 25,000. For 2 years, it's 36,000, and for 3 years, it's 45,000. Again, you guys can use my referral code, and we have an offer going on. That is a 3+1 offer. If you purchase it for 3 months, you guys are going to get 1 month free of cost. So we are going to begin with cardiovascular physiology. We are going to begin with cardiovascular physiology. Okay. So what's the topic for today? As you guys can make out from the title, the topic for today's class is going to be the basics of cardiovascular physiology, right? We are going to talk very basic stuff. Give me a second. Right. Just made an adjustment here. So now my video should stabilize. Right. So the topic for today's class, it is cardiac muscle. We are going to understand cardiac muscle. We are going to understand cardiac action potentials. We are going to understand cardiac action potentials, as well as we are going to understand before we do all that, we'll be going through the basics of cardiovascular System Physiology, CVS Physiology. So I just want to introduce you to the series today, and then we'll have more classes from tomorrow. Tomorrow we have the YouTube festival, so we have a lot of sessions planned for tomorrow. I'll be taking class on cardiac cycle, heart sounds, and Vigor's diagram. Okay, so those are the classes planned for tomorrow. I'll just update the links also. Okay, so if I begin with an introduction to the cardiovascular system, if I give you an introduction to the cardiovascular system, you have to understand what are the components. What are the components of the cardiovascular system? That's the first thing that you guys need to understand. Okay. So the components include, the components are three. First of all, you have the heart, that is the pump. Okay, that is the center, the heart of the cardiovascular system is the heart. Okay, second thing is the vessels that are going to conduct, the vessels that are going to conduct. So your conduction system, which includes what? The arteries and the veins, the arteries and the veins. And the third part is involved in exchange, and that is the capillaries. Okay, besides that, inside these vessels, you have another important component that is there, that is going to be blood. Okay, so the cardiovascular system, when you study it as a whole, we are going to discuss all these aspects: the vascular aspect, the cardio aspect, and the aspect related to blood. Okay, so that is the hematology part. But what we are going to do is, right now we are going to focus on the heart. Right now we are going to exclusively focus on the heart. Right? So should we begin? So this first session, yes, this class is for NEET PG also, for FMG also, for First Prof also. It will be in a very comprehensive way. And if you want a slight guidance regarding from where should you read CVS, okay, there is one absolute recommendation when it comes to CVS. Okay, CVS Physiology and Renal Physiology, the master of these two physiologies was Guyton, right? If you know, Guyton was a physiologist, and these two subjects were his mastery areas. Okay, so Guyton is the best place to read cardiovascular physiology. There is no other source you should go to for CVS Physiology. Okay, so CVS Physiology, I'm going to absolutely recommend Guyton to you. Okay, that's the recommendation. So now, since we are going to talk so much about the heart, whenever we talk about an introduction to the cardiovascular system, about the vessels, there is one thing that you have to understand, right? So vessels, they are like a circuit in your body. They are like a circuit in your body. So I have drawn some units of the circuit. If you recognize from your class 12 electricity knowledge, so what all have I drawn? I have drawn a, first thing that I have drawn here is a resistor. This is a resistor. Second thing I have drawn here is a conducting wire. I have drawn is a conducting wire or a conductor, right? And the third thing that I have drawn here is a capacitor. So in your body, there are certain vessels which are responsible for resistance, and those are the small muscular arterioles. Small muscular arterioles, they are responsible for resistance. Okay, now conductance, it is the role of large arteries, large elastic arteries. It's the role of large elastic arteries, right? Now why is that? Because see, in this muscular arterioles are more muscular as compared to these large arteries, so they are able to constrict, and because let me shut down this fan so that the background noise is reduced, right? So you guys can hear me, I hope, better now. Is there an improvement in how much you guys can hear me? Okay, right. So Janvi, yes, if you are a first year MBBS student, you can definitely start with this lecture. The reason is I am going to build you from the very basics and I'll take you to the most advanced stage. Okay, So don't worry, this is going to be a complete session. I won't leave it in between. These will not be short series, right? So I will do it in a complete way, like a proper course, okay? And Anurag, as far as Genong is concerned, okay, there are certain things that are given very well in Genong. No doubt, Genong is a very good textbook. It's the reference textbook for anything. But if you are a first-time reader and if you want to read it from the start, that's the place to read it. If you are someone who has already read the cardiovascular physiology, you have read the pharmacology, you have done the medicine part, and then you want to revise physiology, then you can go for Genong. Then you can go for Genong, right? So I was saying, from your class 12 knowledge, you remember that you had resistors, you had conductors, you had capacitors. So resistance will be provided mainly by whatever is muscular. Okay? If something is muscular, it can constrict and it can provide resistance to flow. So it is like a resistor. Then what about conductor? Your large elastic arteries, they are able to take large amount of blood with them. So they are conduction vessels. And who are the capacitors? The veins are the capacitors. The reason is the veins, they have about 64% of your blood is stored in veins, right? 64% of your blood, it is going to be present in veins. So veins can contribute a large, so they can store a large amount of blood. And if you remember that capacitor are used to store charge. What is the function of capacitors? They store charge. Similarly, veins, they store blood. And whenever your body needs blood, these veins, they will undergo vasoconstriction, okay? And they will provide blood to your body. So veins are capacitors. Veins are capacitors, okay? You all know who are the exchange vessels? Capillaries. Capillaries are the exchange vessels of the body. Capillaries are the exchange vessels of the body. So now you understand what is the exchange, what is the resistance, what is the conductance, and what is the capacitance. Okay? So those four things are clear to you. Now let's start with cardiac muscle. Next we'll move to cardiac muscle. That's the second topic for today. Okay. So let's discuss the histology of the cardiac muscle first. Okay, although the details you will actually learn when you are doing histology, but whatever is relevant here. First thing, cardiac muscle cell, if I want to say grossly, okay, structurally it resembles what and functionally it resembles what. Okay, structurally it resembles skeletal muscle and functionally it resembles smooth muscle. Functionally it resembles smooth muscle. Okay, why? Because functionally it is involuntary in nature, right? It is resistant to fatigue, okay? But structurally it has presence of, okay, these structures are important. So it has presence of striations. It is uninucleate. Okay, so that is a feature that is different. Okay, third thing, it has branching. It has branching. But perhaps the most important feature that you guys need to understand to be able to grasp the physiology is that cardiac muscle, it has what are called as intercalated discs. It has intercalated discs, right? And what is the importance of intercalated discs? What is the importance of these intercalated discs? They are sites of gap junction. They have gap junctions. So what are gap junctions? Gap junctions allow the transfer of molecules, ions across cell membranes, right? And because gap junctions are going to allow the flow of ions, they allow the cardiac muscle to become a functional syncytium. What is the meaning of a syncytium? It means that a unit that behaves like one. It means, so for example, you have one cardiac cell, okay? Then you have another cardiac cell. Then you have another cardiac cell. So whatever changes are happening in this cell, they can be communicated to this second cell via gap junctions. So gap junctions are interconnections between the cells which allow the cardiac muscle to act as a syncytium, right? So we'll now see some of the properties of cardiac muscle. We'll see some of the properties of cardiac muscle. Any doubts so far? Any doubts so far? Any doubts? Right? So, okay, we'll first study the properties of cardiac muscle. The first property is that cardiac muscles, they are excitable. Okay, cardiac muscles, they are excitable. ठीक है. So does anybody of you interested in dance? Okay, so in dance what happens, there is a choreographer and then there are dancers. There is a choreographer and then there are dancers. So if the choreographer tells a particular step to the dancers, they are able to dance, right? So if he excites them, they get excited, so that property is called as excitability. Cardiac muscle cells, they also have another property, that they are self-excitable. Okay, so some of the cardiac muscle cells, they are dancers, and some of the cardiac muscle cells, they are also choreographers. That is, they can ask the other cells to get excited, so they are self-excitatory. Okay, there are, even your muscles are excitable, even your normal skeletal muscle is excitable. If a nerve becomes the choreographer, the muscles, they can dance, right? But cardiac muscle, it is also self-excitatory. It does not require anything else. It has the property of self-excitation. If you know about the pacemaker of the heart, the SA node, it is going to be the choreographer of the entire heart. So excitation means you're a dancer. You can dance. Self-excitation means you can choreograph, right? It's somewhat like there's an actor and there's a director. The actor, he can get excited, but the director is the one who is going to excite the actor. Okay, so cardiac muscle cells, you will also have actors, you will have directors. So the property of excitation, it is called as bathmotropy. Okay, there are a few terms that I will introduce with every property, so try and understand those. Okay, so if there is some pharmacological agent, or let's say there is some molecule that increases the excitability of a cardiac muscle cell, that is called as a bathmotropic agent. Understand? That is called as a bathmotropic agent. Just give me 1 second. Okay, right. So I guess it's a little better. I've added a noise filter. So what I was saying to you guys is that the property that is related to excitation is called as bathnotropy. So if an agent, it increases the excitability of cardiac muscle cell, that will be called as positively bathmotropic. Right? Then there is a property called as self-excitation. Okay, self-excitation. It means what is the rhythm of the heart. Okay, the heart will obviously have a rhythm, right? So if the pacemaker, if it increases the rhythm of the heart, that is going to be called as chronotropy. If there's something, it increases the rhythm of the heart, that will be called as chronotropy, and something that decreases the rhythm of the heart, that will be called as negatively chronotropic. So positively and negative, right? Then third property is that cardiac muscle cell, it is also contractile. That means that it can contract when there is an action potential. Huh. Aditi, yes, skeletal muscle, it's not branched. So that's why I said that there are some properties that it shares, but otherwise cardiac muscle is unique. Those structural properties are also not shared with the skeletal muscle. Please keep that in mind. Normally skeletal muscle, it's not branched. Okay. Third property is contraction, and the word associated to contraction is ino. Okay, so if something is positively inotropic, it means that it contracts very forcefully, and if something is negatively inotropic, it means that it has a poor contraction. So we have learned about three properties: bathmotropy, chronotropy, and inotropy, right? But otherwise, cardiac muscle is unique, structured, very comprehensive way. Okay, so I hope you guys can hear me and everything is okay. You guys can hear me well. Okay. So one more property that I'm going to tell here only is related to relaxation. Because they can contract, they can also relax. And the property related to relaxation is called as lucitropy. Okay, got it? Lucitropy. And last thing, that cardiac muscle cells, they can not just contract, they can not just get excited, they can also conduct. They can also conduct potentials, which means because of the presence of gap junctions. So that is called as dromotropy. That is called as dromotropy, right? So now let me remind you of these 5 properties very quickly because these are slightly relevant. Pathmo, chrono, right? Ino, Lucy, and Dromo. So these are 5 words used for cardiac muscle, right? For properties of the cardiac muscle. If something is able to get excited, if something is getting more excited, okay, okay, understand this. Let's say this is the basal level of functioning. Let's say this is the basal level of functioning. If something is more than basal, right? If something is if something is more than basal, that means it is positive. It is positively something, right? And if it is less than basal, it means it is negative, right? So positive bathmotropy means more excitable than normal. Negative bathmotropy means less excitable than normal. Positive chronotropy means more heart rate than normal. Negative chronotropy means less heart rate than normal. Positive inotropy means more forceful contraction than normal. Negative inotropy means less forceful contraction than normal. Positive lucitropy means faster relaxation than normal. Negative lucitropy means slower relaxation than normal. Positive dromotropy means faster conduction than normal. Negative dromotropy means slower conduction than normal. Understood? Clear? Okay. So what are the other properties? I've already told you that the cardiac muscle, because of the presence of gap junctions, it is going to be a functional sensation, which means that the atria, they are going to all contract together. Either the atria will contract or they will not contract. So it's a all or none phenomena and it applies to the entire sensation. Okay, so the atria are a sensation, the ventricles are a sensation, and in between them you have the fibrous atrioventricular septum. Okay, so this point is very important to remember. When you draw the heart, this is the right atria, this is the left atria. Okay, this is the right ventricle and this is the left ventricle. So in between them you have some septa. Okay, so the septa that are present between the atria is interatrial septum, between the ventricles is interventricular septum, and between them you have AV septum. Okay, AV septum. So this atrioventricular septum, it is made up of fibrous tissue. Okay, it is made up of fibrous tissue. So the impulse, it cannot pass through the AV septum except for the AV node and the AV bundle, right? I'll tell you when we do the conduction system of the heart. I'll tell you in detail. But for now, try and understand that both atria, they are a syncytium, so they will contract together. Both ventricles, they are a syncytium, so they will contract together in a all or none way. Right? Fifth thing, now that we are going to study, is related to calcium. If you remember your skeletal muscle cell, it derived all its calcium from sarcoplasmic reticulum. है ना? From sarcoplasmic reticulum. Cardiac muscle cell, it is very greedy. Okay, it says that I am the heart. I am the most powerful organ of the body. Right? I will take calcium from the blood. I will take calcium from the ECF. I will not keep my own calcium. Right? So despite it does keep some of its own calcium, right? More than like the smooth muscle. So it does keep its own calcium, but it is also dependent on the calcium present in the extracellular fluid. It is also dependent. The contraction is also dependent on the calcium present in the extracellular fluid. Okay, ECF calcium. Okay, done. Okay, great. So this point we'll see later when I ask you what is the effect of extracellular calcium on the contraction of the heart. I'll ask you this. Okay. Then these are 5 points done. Sixth point, cardiac muscle cell, it has a prolonged refractory period. Now what do you understand by this particular point, that it has a prolonged refractory period? Do you guys understand anything by this particular point? Is there something that develops in your mind? So for this, you will need a little bit knowledge of cardiac action potential, right? If you understand skeletal muscle. Let's say this is skeletal muscle. So in skeletal muscle, what happens? The action potential, it is for a very small time. Okay, the action potential, it is for a very small time. So there is an action potential very quick that the nerve gives, right? And after the nerve has given the action potential to the muscle, the sarcoplasmic reticulum gets activated and then it contracts. Then it contracts, right? So this is contraction and this is excitation. That is true for skeletal muscle. But for cardiac muscle, what happens? Try and understand. Cardiac muscle contraction, it's not so simple. There is a plateau phase in it. Okay, so it's very long. So when the contraction starts, then the excitation occurs. Very soon after that, the contraction starts, and contraction, it overlaps with the excitation. Okay. So when excitation is going on, contraction also starts. So because of that, the refractory period is very long. Okay. For this, the refractory period is only this much. But here the refractory period is this much. So that is why you can have tetanization. In skeletal muscle. Okay. Because I can keep giving excitations like this. I can keep giving more excitations like this. Because electrical activity is going to precede the mechanical activity. Whereas in case of heart, the mechanical activity is simultaneous, or it is almost simultaneous with the electrical activity. Understood? Okay, great. So that's one more property of the cardiac muscle that we have covered. Last, seventh property, not the last property, the fact that it is resistant to fatigue. So it does not get tired. Cardiac muscle, it does not get tired. Okay, kabhi thakti nahi hai. It can keep on contracting till the person is alive. If it stops contracting, you will die. So cardiac muscle is resistant to fatigue. It does not get tired. Very obvious. Okay. Mechanism of EC coupling and Frank-Starling law. These are two very important properties. So let's try and understand them in detail. Frank-Starling law we'll also cover when we are going to be doing what? Cardiac output. When we are going to be talking about cardiac output, I'll come to Frank-Starling law again, right? Don't worry about that. For now, let's talk about what is the mechanism of excitation, contraction, coupling in case of cardiac muscle. In case of cardiac muscle, what happens, right? So let's try to draw a diagram. Right? So there is a sarcoplasmic reticulum also, and there is extracellular fluid also. There is a sarcoplasmic reticulum also, and there is an extracellular fluid also. So while contraction, let's say this is the cardiac muscle membrane, and this is a T-tubule. Which can allow for entry of calcium, right? So from outside, from the ECF, you take up calcium when you have an action potential. Take up calcium from the ECF, and that calcium, it goes inside. Okay. Besides that, what else happens? There is the sarcoplasmic reticulum inside. Now this sarcoplasmic reticulum, it is also going to give its own calcium, right? So that increases the amount of calcium inside the heart, and that calcium, it is used for contraction, very similar to what happens in the skeletal muscle. Right? Now the important part is to understand the relaxation. Now for relaxation, the cardiac muscle, it has its own mechanism. The calcium, it is released. The calcium, when there is repolarization, all right? This is the sarcoplasmic reticulum. Here you have a pump called as SERCA, smooth endoplasmic reticulum calcium, right? So there is something called as SERCA, and that is going to take up the calcium. Besides that, what is going to happen? It is going to go out of the membrane, and at the membrane you have certain transporters, right? So at the membrane, what transporter do you have? One that sends out calcium and takes in sodium. Okay, it takes in sodium, and that is linked to another pump that is going to send out the sodium and take in potassium, right? So sodium goes out, potassium comes in. So understand what is happening. Calcium, how is it helping in relaxation? How is relaxation occurring? So for relaxation to occur, first SERCA, right, smooth endoplasmic reticulum associated calcium ATPase, that is going to take in calcium into the smooth endoplasmic reticulum. But calcium, it had also come from the extracellular fluid. So how is it going to go out? So it will go out, and inside, because you are giving positive charge outside, so you will take in sodium. You will take in sodium, right? Now sodium, when it comes inside, it comes at a cost, and that cost is paid by ATP. And you all know of sodium potassium ATPase. Sodium potassium ATPase. So sodium is going to go out and potassium is going to come in, and here you are going to spend ATP. So this is called as secondary active transport. This is called as secondary active transport. At the cost of the sodium potassium ATPase, you are transporting calcium outside. So that is where you are spending energy of the heart. That is where you are spending energy of the heart, right? So that is about the excitation contraction coupling in cardiac muscle. Okay. And last topic is Frank-Starling law. Frank-Starling law. So Frank-Starling law, I'll be discussing in detail when we are doing cardiac output. When we are doing cardiac output. But for now, what you can understand for Frank-Starling law is that force is proportional to length. Force is proportional to length, which means that if, let's say, this is the cardiac muscle, and let's say it is of 1 meter. Let's say it is of 1 meter. So when its length becomes 1.2 meter, it is able to contract more forcefully. It is able to contract more forcefully. The reason is that there is better overlap, and there are certain lattice changes which allow this to happen. So this is called as Frank-Starling law. Okay. When we discuss heterometric regulation of cardiac output, I'll talk about it. So what this allows is, when there is another way to write this. When the preload is more, the force of contraction is greater. The preload is more, the force of contraction is greater. That's another way to write about the Frank-Starling law. That's another way to express the Frank-Starling law. Okay, so have you guys understood till here? Have you guys understood everything till here? Any doubts till here? Any doubts till here? You guys can express. Any doubt? Okay, so we have almost taken, let's say, half an hour. है ना? So I think that you guys also must be tired. So what we are going to do today is that we are going to end the session here. This I also wanted to discuss cardiac action potential today, right? But I don't want to make the lecture too long. I don't want to make the lecture too long. So we'll keep it short. I'll schedule a session for tomorrow. And tomorrow we'll take some extra sessions because tomorrow we have a YouTube festival, right? So tomorrow I'll start with the discussion of cardiac action potential, right? And then we'll discuss cardiac cycle. We'll discuss heart sounds, right? We'll discuss everything. Don't worry about that. So we'll discuss cardiac action potential, and another reason I'm not discussing it today is that we also have to discuss ECG. So it's better if you understand all the electrical activity together. If you understand all the electrical activity together. So today we'll finish with cardiac muscle and its special properties, right? So that was an introductory class to the CVS, and with that we have begun with your cardiovascular physiology. Okay. So I will also be covering after this cardiac cycle. I'll be covering cardiac action potential because that is again a very important topic, whether it is for your NEET PG or your FMG or your profs, right? Cardiac potential, action potential, right? And then after that, I'll be discussing cardiac cycle, Bigger's diagram, heart sounds, right? and then I will start with your electrical activity of the heart, that is ECG. Okay, I'm going to explain that. Okay. After that, we'll keep moving regarding the regulation of blood pressure, etc. So that's a introduction to this series. I hope you guys are able to understand everything. Okay. So thank you so much, guys, for watching this particular video. Remember to hit the like button on this video and subscribe to the channel Let's Crack NEET PG. Do remember to drop a comment if you guys like the video and subscribe to our Telegram channel. The link is in the description at the rate Let's Crack NEET PG. Just search that on Telegram, you'll be able to find it. Remember to hit the bell icon for notifications. Chetanya10 is my referral code in case you guys are planning on taking a subscription. Okay, guys? Take care. Take care. Have a nice time. Bye bye. So, cardiac action potentials, I'll make sure to cover